Hello, I'm Dr. Dennis McKenna. I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, November 11th, giving you the update from Albany Med. Fred, it's Veterans Day.
It is Veterans Day.
We'll talk about Veterans
Yes,
Day in a bit.
yes.
All right, 11/11 at 11.
That's
in the
right.
morning. Here's the first graph, New York State, people in the hospital with COVID. We still are under 2,000. That number is 1,881. Next graph is Capital Region. Not coming down as quickly as I'd like to see.
It's kind of plateaued.
Plateaued.
Yeah.
So we're currently at 173 in the 8 counties of the Capital Region. Next graph is admissions and discharges here to the medical center. If you added up those numbers, Fred, over the last 7 days, we've had 24 admissions and 24 discharges.
That's right.
And then here's the last graph here, which is the morning census here at Albany Med. Break it down a couple different ways. 33 in the hospital right now, 32 adults and 1 children. Of the 33, 11 in the ICU and 7 on ventilators. So that's a number obviously very similar to a week ago. And then, Fred, we learned about our first flu case, right?
That's right. First flu case admitted. And Dennis, just to make the point we've made before, of the 33 inpatients, the majority of them are unvaccinated.
Yeah, absolutely, absolutely. Fred, this other graph here, we call this our variant graph. This is the one where horizontal axis is time up to the current date, and vertical axis is different strains of the virus. And what does it show us?
It still shows, Dennis, that the Delta variant is basically the variant. There's nothing else.
Yeah, it's like 100%.
It's 100%, that's right.
I think last week was 99.7.
And so, Dennis, this is really good news because a new variant, if it were to arise, may not be as sensitive to the vaccine as the Delta.
You have said that, and that is true. Here's one more graph. I'll call this one our black, blue, red graph, and it shows a couple different things, but the important line to focus on is the one at the top, which is the black line, and that shows the effectiveness of keeping people out of the hospital if they have been vaccinated. And Fred, that number still remains very, very high.
Right, it's 95%,
95%
effectiveness, which is really tremendous.
All right, so again, as we've said before, it's not 100% effective. There are breakthrough cases, we know that. Those breakthrough cases generally tend to occur in people who are more at risk, that same population.
That's right.
But 95% is a very strong number.
And Dennis, over time, there seems to be an increase in breakthrough as well.
That's right. Well, let's talk about that as a perfect segue into a study that you have referenced, Fred, that was published in the New England Journal of Medicine. Everybody's heard of that.
That's right.
New England Journal of Medicine. It's a study out of Israel, and you could talk about the population, and I'll kind of tee it up. It leads into the importance of boosters.
That's right. So, Dennis, the Israelis have a very robust healthcare system and good tracking data.
Right.
So they looked at 4.7 million people who've been vaccinated starting back in January all the way through July.
Okay.
And then they looked at how many of them had breakthrough infections, and they plotted that essentially over time. And what they showed was, as you move further and further out from your last shot, the rate of breakthrough goes up.
Okay.
And so that ties in with waning immunity. And there's also data on antibodies going down, et cetera. But it's really strong evidence over time that your immunity does tend to wane.
And this study, what you said it was a couple million people?
4.7 million people. So really robust data. Now, it's an observational study, but still, it's a lot of people.
All right, very good. So support for the booster, which I know I've had, and I
got mine on Monday.
As well,
yep,
right?
Yep, absolutely. It's important.
And children 5 to 11 now eligible, of course, and my son got his just the other day, so that's good.
And on Saturday, our Gen Peds group is going to have a clinic vaccinating kids here at 391 Myrtle as well.
Fred, staying on the vaccine topic, religious exemption. I know we have members of our workforce who currently have religious exemptions, and we said that we would come back to this issue once there had been a legal ruling on that. There was a regional call today. Where are we at with religious exemptions?
So, Dennis, the Second Circuit Court, federal court, lifted the injunction.
Okay.
And so on Monday, the state published new FAQs, facts about the mandate. And in there, they have stated that there's no religious exemption. So that's, I think, what we've been waiting for to hear, how the state is going to react. And so, we have some individuals with religious exemptions. We'll be reaching out to them in the coming days and talk to them about where we go from here.
Okay. Sounds like we'll have some more information next week, but this is
Absolutely.
obviously recent information.
And Dennis, almost all the hospitals in the region are going to do the same thing in the next couple of days.
All right, very good. So those individuals will certainly be getting a call, maybe from their manager, and we'll
Absolutely.
go from there. Okay, Fred, Dancing in the Woods is coming up. I'm going to read most of this so I get the facts correct. Dancing in the Woods, of course, is an annual event. They didn't have it last year.
No, we didn't.
But we're glad to be having it again this year. And this is going to be an event. This is going to be the 38th Dancing in the Woods. And we know that this goes to support our pediatric cancer program around here. It's going to be Saturday, December 4th, 7 p.m. at the Armory at Russell Sage College, which is on 130 New Scotland Avenue right here in Albany. And Fred, we know that this critical support of this goes to the Melody Center for Childhood Cancer here at Albany Med.
It's a very, very important event to support that entity. That's our pediatric hematology oncology group.
Right.
That group treats over 1,400 kids a
Right.
year with cancer, cancer and blood disorders.
Right.
So this support's really important to keep that a robust program so children don't have to go to Boston or Philadelphia or some other major metropolitan area for care.
A few hundred new diagnoses every year.
That's right.
If you want to get your tickets, and I encourage you to do so, community.amc/DIW. They'll put that on the screen for
That's
us
right.
there.
Great.
So very good. All right, Fred, you and I today
We gave blood.
gave our blood.
Gave blood, yes. It's a blood drive. It's probably ending shortly. So you've missed it for today, but you know what? If you go on the website, there are many other blood drives around the region. I think the next one is early next week here in Albany. It's still a critical shortage, Dennis, so it's really important that we all try to do our part. Donate blood.
Absolutely. And importantly, here on this campus in 2022, it's going to be every month.
That's right.
So you'll really have an opportunity here. You could do it 4 times a year here.
That's right. You have to wait, I think it's 56 days in
Right.
between donations. So if you time it right, you could actually do it 6 times
You do
in
6,
a year.
even better.
That's
All
right.
right. So to those who did that, we saw a bunch of people in line. Thank you.
Thank you.
Speaking of thank you, it's Veterans Day. We're an organization which is very proud of its veterans. And today we'll put up a picture. We had a great event where we went around. Fred, there were people in the hospital who we knew were veterans.
Yeah.
And some of us came around. We gave them a small flag and a small token of our appreciation. I had the great pleasure of doing it with Dr. Kurt Edwards, who, of course, is an Army veteran, as is Dr. Edwards, the wife, the spouse.
Mary.
Yeah,
That's
Mary.
right.
So
That's right.
he's a trauma surgeon. She's a pediatric surgeon. They're both Army veterans, both Army colonels. It was a great day.
So, Dennis, I think everybody knows this, but you're a veteran as well.
I
so
am.
Thank you for your service.
Thank you.
I don't have a flag for you, but sincere.
You do on your lapel.
I do.
Yeah.
You can't have that.
No.
A sincere, heartfelt thank you.
Thank you very much. It has been said that Armed Services Day is the day in which we support people who are currently wearing the uniform.
That's right.
Veterans Day is the day we support people who wore the uniform. And Memorial Day is the day we support people, or we recognize people who died in their uniform.
That's right.
But going back to Veterans Day, I think it's also important to recognize not only the veterans, but their families.
Yes.
Because I can tell you from my own personal experience, it's often more difficult for the spouse than it is for the person who's in and deployed. And so if you served, we thank you. If you're someone who supported someone who served, we thank you.
Yes.
And on the internet, there's some nice pictures of our veterans.
Yes.
As well.
And if I can, I'd do a little shout out to my brother who's a Vietnam vet,
Oh, very good.
Luciano.
First name?
Luciano.
Luciano. Very
Yes.
good. And there's a great article on the internet on Chuck March, who's a nurse on D3 North, who's also a veteran. Very, very great story that I
Yes.
encourage you to read about Chuck. And
Yes.
thank you, Chuck, as well. And Fred, you also have a story that you'd like to share today.
A little story, Dennis. You know, we've been talking about our employees and,
Right.
and interesting things about them. So yesterday I had my physical,
Right.
and I had my blood drawn by a phlebotomist out at MedPed. Her name is Goering. And we were chit-chatting. So first of all, she did a great job. I didn't even feel it.
Good.
But we were chit-chatting a little bit. I asked her how long she's worked here at the medical center, and she kind of paused a little bit, and she said, well, sort of 15 years on and off. And I said, what do you mean? She said, well, I started, and then I moved and went someplace else, and I came back, and I moved and went someplace else.
Mm-hmm.
She said, I did that a couple of times, but, you know, she said, I always came back.
Always come back.
She always came back. She said, it's a great place, really love working at MedPed. She's been there 5 years.
Right.
Terrific employee, fantastic phlebotomist. She can have my blood anytime.
Very good. Well, the fact is that there may be some people watching who were employed here who, for one reason or another, left or maybe took some
Yeah.
time off. Come back.
Come back.
We'd love to have you. Capitalize
right.
your career. All right, Fred, that'll do it. We're going
That's-
into the weekend.
yes.
And I was at the Veterans Day Parade today,
Yes.
and so I saw my son march there. So
That's
once
good.
again, to all of our veterans, we thank you very much, and we'll be back again next week. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.